Welcome to Move It Mondays, where we show you how to self-assess and self-treat common injuries so that you can move like you mean it. What's up, guys? Welcome back to the Movement Center Down Under. Today we're with Andy, spelled with an I. Don't mess it up. And we're talking about IT band syndrome here at Fraser Island, largest sand island in the world. We got a boater in the back. What's up? And we're talking about IT band syndrome. And so we have Andy here who's got some pain in her knee. She's had it for a long time. Doesn't like to do any exercises, so we're going to see what happens with her here today. So we're going to talk about what it is, how it works, and then a quick stretch you can do on the go while you're traveling to kind of fix this up for yourself, right? So first thing we're going to do is just have Andy walk towards camera. You're going to watch where she places her feet. So she walks nice and straight, or she's supposed to walk straight, and you can notice that we can track her feet. Get a good look. Yeah, come on back this way, Andy. She did her nails today, so she's looking good. What she'll happen is she kind of takes that left foot and kind of dumps it up. I'm going to exaggerate in this sort of position. So what that can do, if we turn her back around, is, and that can happen for a couple reasons, which we won't go into today. It can be stiffness in the ankle. It can also be your hip kind of dropping in. But that foot turning out will change the angle. This IT band comes in and plugs into the knee. So if we change her, whoop, over this way, perfect. As that IT band comes down and plugs into that part of the shin, it'll kind of flip back and forth, back and forth. People will kind of complain of this pain on the outside part of their knee. So it'll kind of limit or be uncomfortable into this sort of region of the knee, yeah? Into that. And we won't poke it because she won't like that. But essentially there can be a couple things that can lead to that. A lot of times it's hip weakness. So if we now bring Andy over here, you can stay right there, and we have her walk this way towards the water, you'll notice she does what I call a half sexy walk. So that butt kind of shifts out to the one side. So she does this sort of thing, right? This sort of sexy walk, because she wants to look sexy, number one, but number two, there's a little bit of weakness happening in the back of that hip. So what we want to do is tackle that hip stability and strength, ankle stability, and make sure everything in that chain is looking good. For today, we're going to show you guys a quick little tip you can do to stretch out that hip while you're doing your thing, traveling, being awesome. So Andy's going to pop on her back, Andy with an I, let me be clear, and what she's going to do is line up with this. And you can do this seated as well, but we're going to do this here today, laying on the beach. So with her left hip, she's going to bring it up nice and tall, perfect, kind of bring it down like that. The key is your hip stay nice and stable while we do this. The goal is to stretch the back of the left hip. She's then going to bring this up. Now, Andy used to be a dancer, so she's quite flexible. So we want to make sure she stabilizes this hip well. And with her other hand, she's going to push that down and away. And feel that stretch in the back of the hip. Now, if I'm a good friend, I can come here and pin and really kind of drive her knee up, and she'll get a bit more of a stretch in the hip. Yeah, feels good, not too much. Good, and she can hang out here just like this, right? Which is perfect. We also have nice Australian gentlemen lunging in the back of our video today. So that's it. If you have IT band syndrome, make sure you're walking with your feet straight. Check the strength and issues going on at the hip. If you have any questions, let us know. She's going to keep stretching here, and we'll put up a video to exactly how to do this one a little bit more specifically as well. Remember to move like you mean it.